arriving at Stazione Centrale in Milan, I've just had to come through some temperature checks. They're not allowing anyone to walk onto the station without being funneled through a particular area where you'll get a sensor on your forehead to make sure that your temperature's okay, and then I'll let you into the station. I'm about to board the train now to Bologna. As Europe tries to get going again, albeit with temperature checks going into main stations in Milan and being offered masks on platforms in order to get on the train, under COVID-19 there are millions of women that have had to navigate what I'm told is one of the most incredible experiences of their lifetimes, which is pregnancy and childbirth. Now, to get a better sense of what expecting mums are having to go through, we're going to meet in person an OBGYN here in Italy. I'm actually on my way to Bologna right now, who's helping expectant mums navigate this entire experience. This is the University Hospital of Bologna, where Dr. Aly Youssef, who I'm about to go and chat to, he's an OBGYN, and he's been adapting his protocols in caring for pregnant mums and their babies during the pandemic. Dr. Aly, salam alaikum.
Hi, alaikum. Hi.
Let's do a bit of a toe tap here, bit of an elbow. Do it all in Italy, toes and elbows. As an OBGYN, how is COVID-19 affecting pregnant women? What are the threats? What are the things that you've had to navigate from a doctor's and science perspective?
Yeah. We know now that the vertical transmission to the babies is almost absent, okay? And we have now thousands of pregnant women with confirmed data, at least short term, which has demonstrated that the vertical transmission of COVID-19 is extremely unlikely. So from this point of view, women are relaxed.
If a pregnant woman comes to you with symptoms, is her life more under threat because she's pregnant?
No, actually no, fortunately. So pregnant women with COVID-19, of course they do have a risk, but this risk is comparable with other women in their age group, okay, non-pregnant. So, and this is very, very reassuring piece of information that we're transmitting to the patients.
Brilliant. So I'm assuming this is where it all happens inside.
Yeah, please come in.
Here we are, Ali. This is your floor. So this is the temperature check area.
Yeah, he's Antonio is on the front line all the day. First, he have the list of all the patients that coming inside. He asks the partners to kindly stay outside the outpatients clinic.
And what happens if a pregnant mom turns up and she has a fever? What happens then?
Well, this depends on how urgent is her examination. Okay, so if her examination is not urgent, okay, we send her home and we call her again to check when the symptoms have gone. Whereas if her examination is urgent and it cannot be postponed, we deal with her in room number 13, which I will show you now.
Okay, fever control.
You can proceed. So
we can go to Phil. Lovely to meet you.
This is the only room to deal with a suspected or confirmed case. So now it's sanified, so it's safe to come inside. We have not had a suspected or confirmed case for a long time now, fortunately. And the room is prepared for everything, so for blood samples, for swabs, for fetal heart monitoring.
So basically, if a mum comes in and she's presenting with symptoms, you'll test her in here for COVID-19, but also you'll go through the routine checks of pregnancy in here too.
If her visit is urgent and cannot be postponed.
Dr. Aly, I'm super fascinated about the lung and the ultrasound and how you sort of incorporating that in the routine checks. Can we go have a look at the tech?
We do have a portable ultrasound machine which we bring inside and sanify it after its usage. The advantage of lung ultrasound is that it can be done anywhere. So if we see we have a suspected or confirmed case here, we do it here. If we have it in the labor ward, we do it in the labor ward. 5 minutes ago, he was born 5 minutes ago. Right?
The baby we can hear right now was born about 5 minutes ago.
Yeah.
Wow. I'm kind of a little bit overwhelmed by hearing a brand new baby. It's quite a new experience for me, but for you, not so.
Well, yeah. Actually, fortunately, we're used to it.
Can you actually remember your first baby?
Yes, it was in Alexandria in Egypt. Okay, and yeah, I was overwhelmed by it. The first vaginal delivery was when I was doing my residency in Alexandria in Egypt, and my first cesarean section was with my dad, and I was in the 6th year of medical. I was a medical student on 6th year because my father is a gynecologist. So this is what I fell in love with obstetrics. Yeah. I'll take you to the second floor, to the ultrasound unit.
Great. So you'll bring the ultrasound in, you'll do the normal checks on the pregnant mom, whether it's in the COVID room or a non-COVID room,
Exactly.
and then you'll go into the lung checks.
And then we do an additional part, which is the lung ultrasound. Yeah. So we'll be now starting the examination. So what we are doing practically is to check for normal findings. Checking and confirming normal findings is quite easy to learn, especially for someone who's working for many years on ultrasound.
What are normal findings?
Normal findings are mainly by seeing the pleural line. Okay? So the pleura is the only structure that in a normal lung should be visualized. Okay? And beyond the pleura, we do not see lung structure, but we see some artifacts which are parallel lines to the pleural line, and they're called the A lines. So a normal lung has a regular pleura and have A lines.
And what's your biggest piece of advice to pregnant moms who are pregnant during this pandemic and maybe looking to go into labor during this pandemic?
Well, I don't think that I do really have an advice. I have a lot of respect, okay? And because I think that they did a lot of sacrifice in this period. Many women have come to see their babies without their partners. Many of them give birth without anyone beside them, and this is a huge sacrifice. So I think it's just a thank you and stay strong.